family doctor on the front line to this COVID crisis, now recovering from the virus. Dr. Michele C joining us this morning live to share her experience. So Dr. Reed, good morning to you. First and foremost, I understand you were tested early, but I want to ask you, how are you feeling this morning?
Well, this morning I'm still having fever, anywhere between 99.4 going up to 100.1. Very fatigued, having problems still focusing, headaches, can't sleep throughout the night. Occasionally a little short of breath, but I'm working myself through everything.
Yeah. So look, you're also a mom of teenage boys. Walk me through this process of being quarantined within your home, being a mom, what it's like to social distance within your own home, and were your kids tested? How are they feeling?
So I am the mom of twins. Tomorrow they're going to turn 16. And it's been very rough because from the same standpoint, we've been doing social distancing because I've been seeing patients for the past, I don't know how long now, but probably for the past 6-7 weeks, we've been doing our own social distancing. I walk in the house, I would shower, they would fix my plate, I would eat separate from everybody, and then I would just head to the bedroom. Thank God that my husband had got me an iPhone, so through technology, I'm able to FaceTime them. But I mean, it's very hard.
Of course.
It's extremely hard.
What's your advice to parents right now who their sons and daughters live outside the home, and including my own parents, who are saying, you know what, come on over, you sound fine, you sound okay, wear a mask and come in the house?
At this point in time, everyone needs to stay in their own house. No one needs to go visit anyone. This is not the time. My parents are in their 80s. I haven't seen them in weeks myself, and because I tried to be very careful because I knew I was being exposed, and I don't want to expose them because I know with them having comorbidities that it's automatic hospitalization. I wouldn't be able to do anything for them. So it's scary on both ends, and it's best for us to really practice social distancing at this time. Truly stay home. Even though some kids are on spring break, it's not the time.
Of course. You know, you have your own family practice. You're also the school district physician for Malvern, Hempstead, and Roosevelt. And I want to get your take on the reports we're seeing this morning about this affecting disproportionately black and brown communities. You're a doctor in a predominantly black community. Can you speak to that and what your thoughts are overall on these numbers that we're seeing about our healthcare system?
The numbers are devastating, and I think that's one of the reasons why 18 years ago I started my own practice, because I wanted to be able to serve people, but I also wanted to serve people who look like me. As the fit doc, Michele Reed, I've really been good in trying to encourage my patients and those who are not my patients to take care of themselves. So now when it's at a point where people have not been taking care of themselves because of the diabetes, the hypertension, it's devastating to me. Yeah. And that's part of the reason why I tried my best to keep my office open. We started doing telemedicine because I need to be able to service people, not just those that look like me, but everybody. But it does hurt to my heart that black and brown people are being killed unnecessarily because of this, because of the lack of access to health care, because of healthcare disparities, because of housing. We're living cramped houses. So it's a lot to take. And, you know, I'm proud of all of us who are doctors and healthcare workers who are putting ourselves on the line, because we really do care about making sure that all people are taken care of regardless. But black and brown, we are being definitely hit a lot harder.
Just real quick, we only have 10 seconds left. You are still doing telemedicine even though you yourself are sick.
My office is still doing telemedicine. I'm unable to do any telemedicine because I can't focus.
Yeah.
The headaches, the fever, the body aches, the joint pain, it's a lot. And this is day number 13.
I wish you a very speedy recovery.
Thank you so much.
I wish you a very speedy recovery. Okay. Thank you for your perspective this morning and what you do. And check back in with us when you feel 100%. I'd like to hear from you so we can share that part of the story and kind of follow your progress. Okay. So we'll stay in contact with you.
Thank you so much for the opportunity.
Doctor. Of course. Thank you. Thank you. And speedy recovery to you. Okay.